Hi, Dr. Gullberg here, continuing our internal medicine lecture series. Today we're talking about nephrotic syndrome, otherwise known as nephrosis. This is an important disease entity that you want to be familiar with in terms of how it's diagnosed, what causes it, and then a little about the complications of nephrotic syndrome that most people are probably not aware of. So nephrotic syndrome is basically when the body leaks over 3.5 grams of protein into the urine every day. Most commonly, of course, we'll see it in diabetes. These patients have low albumin levels, they have hyperlipidemia, they have increase in edema in their legs, or they can even have anasarca. So when we see a lot of edema, start thinking about possible nephrotic syndrome. They can have hyponatremia as well. So diabetes is the most common cause, but then other diseases that affect the kidney, you should also be aware. Of course, the nephrologists are looking for these diseases all the time, but so should you. Hepatitis B, hepatitis C, lupus, Sjogren's syndrome, sarcoidosis, certain drugs like steroids, gold, IV heroin users, cancers, leprosy, syphilis, malaria, focal glomerulosclerosis can cause it, as well as HIV infection and even morbid obesity. So be aware of some of those causes of nephrotic syndrome. Treatments really, we don't have much we can do. We, obviously have these patients on low sodium intake. We have them on a high protein diet because all the protein they're losing. And of course, in diabetics, we'll use ACE inhibitors from that standpoint. What are the complications of nephrosis? This is what I want you to understand. We see patients, they have a higher risk for venous thrombosis due to leaking of antithrombin 3. They have an increased risk for infection due to leaking of immunoglobulins. They can develop acute renal failure secondary to hypovolemia. They can develop pulmonary edema secondary to hypoalbuminemia. Kids can have growth retardation. Kids and adults can have vitamin D deficiency because vitamin D binding protein is lost. They can develop hypothyroidism because of decreased thyroid binding globulin that's lost through the kidney. And they can develop microcytic hypochromic anemia due to losing transferrin. So less commonly, but watch for hypocalcemia and then Cushing syndrome as consequences of a nephrotic syndrome. So hopefully this gives you a good summary of nephrotic syndrome. Be aware of the disease and its complications. Thanks, Dr. Gullberg, signing off.